So
our body's made up of a big
right.
percentage of it, right?
Right.
Well, so we know that vitamins are essential, but I think that a lot of people don't realize why we need to supplement. Because back in the day, I like to always say, when people ate off of the earth more often, they were getting a lot of the nutrients that we don't get today. And also, if I remember correctly, I read that prescription drugs can sometimes deplete the body of certain nutrients.
Well, there's two reasons that, and maybe three, that I would say that I recommend and use vitamins myself, and have since 1989 when I began to study vitamins. So the first thing would be the food. Americans eat highly processed foods. It's in packages or in bags or in cans. If it's in packaging, bags, or cans, I can assure you it's vitamin and mineral deficient. Even with our bread, you think about bread, it says enriched. What does it mean, enriched? They stripped all the vitamins out of whole grains, and then they have to add some vitamins back in to say they've enriched it. Well, you don't need to enrich whole grains. It's loaded full of vitamins, minerals, and nutrients. The other thing is, in our farming, we load up our plant products with chemicals, all kinds of pesticides and fertilizers that are chemicals that get into the plants, and those adversely affect us because they have to be detoxified.
Sure.
The other thing too is that in the soil today, it used to be you gave the soil a rest. Every 7th year you would let the soil rest and restore itself. Right now we use fertilizers and we grow crops on top of the land, one season after another, and that depletes the minerals that are in the soil that are necessary to be able to make the vitamins that are in the plants. The other thing they do is that they harvest the plants, particularly fruits and vegetables, long before they're ripened.
Really?
The vitamins don't set until the last 2 or 3 days when they're ripening. That's when they set. So you've tasted homegrown tomatoes versus maybe the store-bought tomatoes. One tastes like paper, and the other has rich flavor to it. That's because it's got the vitamins and minerals set in it. They'll take those apples off green and let them ripen off the plant, so they don't have the vitamins and minerals. They don't have the vitamins, minerals, and nutrients.
Yeah.
So that's one reason. It's the food intake that we have. That's why we recommend that you take and eat organic food. That's so very important. The second reason is the chemicals in our environment. Remember, chemicals are substances that never existed before in nature. You got petrochemical products, we got pesticides, we got all kinds of dyes in our food.
Yeah.
We've got phthalates that come in from the plastics. We've got a host of chemicals that we're exposed to that get into our system. Well, they have to be detoxified. That requires the liver to go through a whole series of enzymatic reactions which use up vitamins, minerals, and nutrients. A good example would be alcohol. A person that's an alcoholic can develop a depletion of vitamins. And when I was in training in med school, you'd have alcoholics that come in and they'd be shaking, and when they went through DTs to get delirium tremors, you know what we treated them with?
What?
Vitamin IVs, because
Really?
their livers had been so depleted that they could not properly detoxify the alcohol in the system. Well, this is what happens when we have the plethora of drugs that we come in, the plethora of chemicals that we come in contact with, and then the drugs that were given by our physicians. So everybody's got polypharmacy. People are on antidepressants, anti-anxiety medication. They're on blood pressure medication, cholesterol medication. They're on anti-inflammatory, a host of medications. All these medications have to be detoxified. By the way, all these medications are toxins.
If they have to be detoxified by the liver,
they got to be
sense.
detoxified by the liver. So you detoxify a toxin, and the definition for toxin is poison. So this is how the current medical profession, if you get down to their basic paradigm, is that I'm going to poison you to good health. That is impossible. You can't. Nobody is sick because they had low levels of drugs in their body, and nobody's going to get well through taking drugs in their body. As a matter of fact, the drugs have such serious and deleterious side effects that you're much worse off taking the drugs. You want to get well naturally in their natural approaches, and one of them is the use of vitamins and minerals to help heal your body, especially when you're deficient.
So, and can drugs basically keep the body from absorbing the proper nutrients? Is that Is that the big problem
Well,
here?
it's not so much the problem that it would keep them from absorbing the vitamins, minerals, and nutrients. Although, if a person takes antibiotics recurrently for certain infections, that can disturb the microflora of the gut, the normal occurring bacteria, and it can put them. They can develop colitis, they can develop ileitis, they can develop gastritis, and whenever you have those kind of problems, you're not properly able to digest your food, and you don't get the vitamins and minerals that you need. So that can be a problem from using drugs, particularly antibiotics. But usually the drugs, what they're doing is they're really tearing up the liver. That's why there are some drugs that people take. The doctor's got to come back and get your liver enzymes checked every month.
Yep. I knew that's what you were going to say.
Right.
It's happened to me before.
Right.
Yeah. That makes sense. So besides prescription drugs, I know that probably the audience is thinking the same thing I am. What else, and besides food, you said the food and even the environment, what else could deplete our bodies? I mean, specifically, I'm thinking stress.
Sure.
I mean,
well, that's right. When you come under stress really is controlled by the glands called the adrenal glands on top of the kidneys in the back, which produce the stress hormones, adrenaline for acute stress, fight or flight syndrome, like, big football game, you get all pumped up and the adrenaline's rolling, or you get in a wreck, or something happens, or a house catches on fire and you get that adrenaline rush, you got to get everybody out. That's for acute stress. For chronic stress, your body makes cortisol. That's the natural long-term stress hormones to help you with stress when you have stress from maybe losing a loved one, or losing a mate, or going through a breakup in a marriage, or a relationship, or financial stress, or driving the streets of Houston, or raising a husband, or raising kids. All these things cause stress, and that depletes the cortisol. Well, guess what you need to make cortisol? The adrenal gland requires vitamin C. As a matter of fact, vitamin C concentrates in the adrenal glands 100 times higher than it does in any other part of the body. The adrenal glands, in order to make the stress hormones, need vitamin C. So it's very important for that. So when you're under stress, take a lot of vitamin C.
And sick too. I know that high doses of vitamin C.
Vitamin C is.
What would you suggest for the dosage amount for that? When someone is sick.
Vitamin C, the only mammals who don't make vitamin C are human beings, guinea pigs, and some of the primates, some monkeys. Don't make vitamin C. All other mammals make vitamin C. All the other mammals, dogs, cats,
Wow.
Maybe
that's why dogs can't eat
giraffes,
anything off the ground.
Well, they make vitamin C, and they make an equivalent of 6,000 milligrams for every 150 pound of body weight.
Wow.
Or that would be for every 25 pounds of body weight, they make 1,000 milligrams. So I recommend to our guests, and I take myself personally, for every 25 pounds I weigh, and I weigh about 175 pounds, so I take minimally every day. I take somewhere around 10,000 milligrams of vitamin C every day, but minimally I should take 7. Yeah.
I think people are hearing you say that and think to themselves, that is a tremendous amount of
vitamin C is important not only for the adrenal glands and in supporting the immune system. It's very important in the immune system, and it helps in allergies because it has antihistaminic properties. So you can, if you have an allergies attack, take 3,000 milligrams 4 times a day, take 12,000 milligrams. Only side effects you might get from vitamin C is loose stools, and that's not bad. Then your bowels are clean.
You've got clean bowels.
One of the big problems in America is that people are constipated.
That's
and guess
true.
what we have? We have high
That's
incidence of colon cancer. Keep your bowels clean, you're not going to get colon cancer. I guarantee you that. But you go back to the question on vitamin C. We said that it helps with the immune system. It helps with stress. It helps with allergies. It also helps keep your arteries clean in your heart. Vitamin C is essential for your body to make collagen, which is the protein that lines the inner lining of the arteries. Wow. And what happens when you get blockage in your arteries, that's caused by inflammation. And the body wants to lay down collagen to heal it. If you don't have enough vitamin C plus lysine and proline, these are important amino acids that you need to have to make collagen. If you're low in vitamin C, your body cannot make the collagen required to heal. So it uses its backup mechanism, and that's to lay down lipoprotein like cholesterol to try to use it as a Band-Aid. So cholesterol is never the problem. It doesn't cause heart disease. It's the inflammation that people get in their arteries, and that inflammation in the arteries can be caused by chemicals in the environment, mercury, like mercury that leaches out of your fillings in your teeth, and it can come from anytime you have an infection. If you got bad teeth, the anaerobic bacteria leach chemicals into the system, and they tend to hit the coronary arteries and cause inflammation. Anytime you get an infection, you get the toxins from the bacteria, and you get the bacteria in the blood floating around, and they will cause inflammation in the coronary arteries, and they have to be healed. The body doesn't like a sore. On the outside of the body, it heals and scabs over. It does the same thing on the inside of the arteries, and it scabs over using lipoprotein if you don't have enough vitamin C. And this was all shown and demonstrated by Dr. Linus Pauling and Dr. Matthias Rath back in 1990 when they wrote their paper on the cause of coronary artery disease, and showed and demonstrated clearly through their studies that it was caused by a vitamin C deficiency. It's like a scurvy in the arteries. But you know what? That's too simple an answer.
That's
and,
right.
You have to do the thousands. The treatment of coronary artery disease is a multi-billion-dollar business. Now, what cardiologist in his right mind, when he can make $7,000 or $8,000 doing angioplasty, is going to say, before we do that, why don't we get you on a good eating program, get you to eat natural, maybe a vegetarian diet. On a vegetarian diet, you can clean out your arteries and take that and vitamin C. As a matter of fact, I've been on vitamin C now, copious amounts of vitamin C since 1990, and have had the CAT scans, the arteries and all that, and they're just clean as a whistle, no calcium at all. And my father he had coronary artery disease.
Right. So the chances, statistically, you would
think, people think it's genetic. It may or may not be genetic. I think it has a whole lot to do with
lifestyle.
With our lifestyle. Somebody said this: more people develop coronary artery disease not from the genes they inherited from their parents, but from the recipes they inherited.
That's a good quote. That's very interesting. As we're talking about some of those vitamins that help with sickness, I can't go forward without saying or giving you the opportunity to talk about vitamin D and the importance of building that immune system with vitamin D.
Well, it's very interesting. It's been shown that the vast majority of, as a matter of fact, in our office, 95% of the people come in have very low levels of vitamin D. And vitamin D is so very crucial for immune system health. Now, vitamin D, of course, is made as the sun comes down and hits our body, hits our skin, and it converts cholesterol into vitamin D, which is really a hormone. Vitamin D is.
I don't know that a lot of people know that.
Yeah, but it's hormonal structure. It's made from cholesterol. All your hormones, your sex hormones, your adrenal hormones, are made from cholesterol. It's an essential part of our body. Most people think cholesterol is bad for you. If you don't have cholesterol, you're going to be very, very sick. You can't make your hormones. Well, one of the hormones that is made is vitamin D. And vitamin D is critical for immune system health, for cardiovascular health, and it's shown that people that have high levels of vitamin C have a dramatically lower incidence of cancer than people that have low levels of vitamin C. So when people come in, we see their levels sometimes in the 15 or 20. It should be up above 75, closer to 100. So we recommend in our guests to take anywhere between 5,000 and 10,000 international units daily of vitamin D3, which is the active vitamin D, vitamin D3. And we follow that. We'll check the, we'll follow the levels to make sure those levels come up. But vitamin D had been unrecognized for years, but really over the last 5 years have been a tremendous amount of research has become public and has been popularized. So vitamin D is very important.
All of these supplements, vitamin C, vitamin D, CoQ10, we didn't talk about that one, but that's the
CoQ10,
a great antioxidant.
Well, CoQ10 enables your cells to produce energy, the brain to function, and the heart to function properly. Interestingly enough, the statin drugs affect the liver. Coenzyme Q10 is made in the liver, and it blocks the chemical pathway that allows CoQ10 to be produced. Guess what that leads to? Well, that leads to a mental loss of mental acuity, mental confusion. It leads to rhabdomyolysis, which is with the breakdown of the muscle tissue.
Oh, wow.
And which a lot of people, they'll get on these drugs and they feel terrible. They ache all over. They
Right.
can't think clearly. Plus, it leads to congestive heart failure. It can lead to congestive heart failure.
Which is the
one of the
reason.
One of the treatments of congestive heart failure in Japan is they use Coenzyme Q10. And so if anybody is on a statin drug, which we don't believe you should be on a statin drug, but if you're on a statin drug, for crying out loud, you ought to be on Coenzyme Q10 at least 200 milligrams, maybe 300 milligrams a day, because you're not making any. That's really critical and important for your cardiovascular function and for your mental health.
All of these supplements that we were just discussing, all the nutrients that you really need on a daily basis, including, as I'm looking at it, I'm realizing we didn't talk about the fish oil either. Why is fish oil so important?
Fish oil is important for two primary reasons: cardiovascular function, and it's very important for brain function. These are essential fatty acids that are in that. And you know, for decades, in the old days, people used to give, way up north, they'd give cod liver oil. I don't know if any of you all ever had your mom wake up this morning, we'll give you
I've heard of
a
it.
teaspoon. Now, my mom didn't do that, but I heard about cod liver oil. And the reason they gave cod liver oil because they knew it produced good health. It helps with the immune system, it helps with cardiovascular function and brain function. Those three are very important.
So so all of these nutrients, all of these supplements are in the Power Pack.
Okay.
Which is something that you compiled and put together.
Okay. What I came up with it was a Power Pack. And it means just what it says. It puts energy and power back in your life. And so what it has in it, it has 3 of our energy formula, which was the first proprietary formula I came up with, which is a multivitamin, and there are 3 in each packet. And you take these packets up to 3 times a day, at least twice a day. Some people take them once a day. That's a whole lot better than not taking any at all. But it's got 3 of the energy formula, which is a very super powerful B complex. It's got vitamin C, vitamin D, vitamin E. It's got the minerals that you also need, and it's very, very key ingredient to our Power Pack. We also have Coenzyme Q10, which I just spoke about, which is so important for cardiovascular function and brain function. We've got L-arginine and we have L-taurine and N-acetylcysteine, which are amino acids which are very important for energy production in the body. We also have,
if I remember correctly, it takes stored body fat and converts it to energy.
It does. Well, that's L-carnitine. That's L-carnitine that does that, and we have that in there. And of course, then we have the Nordic Natural Pro Omega fish oil,
which is a very pure form of the fish oil.
And Nordic Natural is the premier producer of fish oil in the world. And
Wow.
we're the only people that they've licensed to allow us to include their product in our Power Pack. It also contains vitamin D, which we talked about how essential that is for good immune system function, and alpha lipoic acid, which is a great detoxifier. It's important for detoxification. Let me say something else about vitamin D. What happens, when do people get health problems? When are health problems really the worst? Infectious disease problems. Usually during the winter. And that's when we see flu outbreaks during the winter. It's all during the winter. And one of the reasons is because we have much less sunlight during the winter. It tends to be cold. People tend to stay inside. They don't make enough vitamin D. So this is one thing that's very important, the taking of vitamin D, particularly during winter months. Another thing it causes, when people have low levels of vitamin D, they'll get, and we see this during the winter, people get seasonal affective disorders. And that can be controlled with proper intake of vitamin D.
Lack of vitamin D, and also with moods.
Right, well that affects their moods. When they get these seasonal, they don't get enough sunlight, they're not